thanks very much to the organizers of this event, the people who put the grunt work in that makes it possible for us to come together tonight. And thank you all for coming out. It gives me heart to see a good crowd here. Now, I work with Maryland UHCAN, Universal Healthcare Action Network. Our main purpose is to advocate for a single-payer health insurance system along the lines of what they have in Canada. So I've been to a couple of forums of this kind about the effects of military spending domestically, where I say we don't need the money for the healthcare system. If we had a single-payer system, everyone would be covered. To put everybody into a publicly funded system, one of our main slogans is everybody in, nobody out. By that we mean everybody in, nobody out. Everybody in the wealthiest. Everybody in the wealthiest society in human history should be able to get help if they're in distress. That could be done with the amount of money that we're already spending on health care. But we have a profit-driven system. I don't have time to go into it. I have 3 minutes. But we really don't need money that would be saved from military spending for health care in this country. However, we are stuck with the bizarre, profit-driven health care system that we have. So there are plenty of things. I thought I was going to hear a whole litany tonight of different ways that the military money could be spent, but there are plenty of things right here in the United States that this money could be spent on. In every state house in the country, there's a struggle every year about Medicaid programs and Medicaid-related programs. Plenty of money in that military budget and in Bush's tax cuts for the rich that could be going to Medicaid people all over the country. There's the S-chip debate that we've been treated to over the last year. One economist, Dean Baker, a guy that I have learned a lot from, estimates that 2 weeks spending on the war would cover the cost of S-chip. That's 2 weeks. We're now 260 weeks. So that's 1/130th of the war spending that could be spent on insuring more children. And finally, and most obviously for our purposes here tonight, is treatment of veterans. Okay, there are a lot of people here who know a lot more about it than I do, so I won't go into it. I can tell you this, though. Back in the 1970s, the veterans movement borrowed a slogan from the old people's movement. And that slogan is, use them once and throw them away. So I think we're facing a really serious decision as to what kind of world we want to live in, what values we want to underpin the kind of world we want. Do we want the values that say everybody in, that say every person's life is precious? Or do we want a society that's based on the values of use them once and throw them away?